I'm going to walk you through 7 silent signs your kidneys may be sending you. We'll start with the earliest and most commonly overlooked symptom, the subtle ones that people dismiss, and then we'll move towards the more serious warning signs that require urgent attention. If you're new here, hi, my name is Ali. I work as a GP or family medicine resident doctor here in the UK, and on this channel, we'll break down medical topics into clearer, more practical information you can actually use to protect your health. I also focus on longevity, metabolic health, and prevention. If you find this helpful, consider subscribing and liking this video. It really helps the channel reach more people who might need this information. Let's get started. First sign, extreme fatigue. You know that feeling when you wake up after 8 hours of sleep, but you still feel like you ran a marathon. That bone deep exhaustion that coffee can't fix. My friend used to tell me I'm just getting older. He was about 45. This is normal, right? Wrong. Here's what's really happening. When your kidneys start to fail, they can't clean your blood properly. Imagine your blood is like a swimming pool. Your kidneys are the filter system. When the filter system breaks down, toxins start building up in that water. Those toxins are called toxins. Big word, simple meaning. They are waste products that should be ideally leaving your body, but instead they are floating around in your bloodstream, making you feel exhausted. But there's more. Your kidneys also make hormone called EPO or erythropoietin. Think of it as a factory manager that tells your body to make red blood cells. Red blood cells are like delivery trucks carrying the oxygen to every part of your body. When your kidneys fail, they stop making enough of this hormone, the EPO we just talked about, which means less delivery trucks, less oxygen, and more fatigue. Studies show that 70% of people with chronic kidney disease report feeling tired. That's 7 out of 10 people. Compare that to people without kidney disease, where only 34% feel this way. So if you're constantly exhausted and you can't figure out what your kidneys might be trying to tell you something, let's move on to the second silent sign, unexplained swelling. Let me paint you a picture. You take off your socks at the end of the day, and there's a deep indent around your ankle. Your finger rings suddenly feel tight, or your shoes don't fit the same way anymore. That same friend of mine who was 42, when I asked him about it, he said that he must have eaten too much salt. And sometimes that's true, but sometimes it's your kidneys waving a red flag. Here's the science. Your kidneys are very smart. They decide what stays in and what goes out. One of their main jobs is controlling the balance of salt and water. When your kidneys are failing, they can't remove extra fluid from your body. That fluid has to go somewhere, and gravity pulls it down to your feet and ankles and legs. It's called edema. Think of your body like a sponge. When a sponge is oversaturated, it can't absorb any more water. The water just pools at the bottom. That's what's happening in your body. This swelling usually starts in your feet and ankles because that's the lowest point of your standing or sitting position, but it can also show up in your hands, your face, even around your eyes. The key word here is persistent. Everyone gets a little swelling sometimes, especially after a long day or a salty meal. But if the swelling doesn't go away, or if it's there morning after morning, that's when you need to pay attention. Moving on to the third silent sign, urination changes. This is where things get personal, but we need to talk about it because your urine is like a report card from your kidneys. There are 3 main changes to watch out for. First is foamy or bubbly urine. Some of my patients would walk in and would say that their pee looks like cappuccino in the toilet. We all laughed, but it wasn't funny. Foamy urine is a sign of protein in your urine called albuminuria. Your kidneys are supposed to keep protein in your blood, like a strainer keeping pasta in the pot while the water drains out. When the strainer gets holes in it, the protein leaks through. This is serious because protein is essential for your body. You need it for healing, building muscles, and fighting infections. When it's leaking out in your urine, that's a problem. The second thing is frequent nighttime urination. This is called nocturia. It's when you have to get up multiple times during the night to urinate. Here's what's happening. Healthy kidneys would usually concentrate your urine at night so you can sleep. But when kidneys fail, they lose this ability. They can't hold on to salt properly. So your body has to flush it out at night instead. Studies show that as kidney function decreases, nighttime urination increases. It's your kidneys working overtime trying to do a job they're no longer equipped to handle. Third thing is changes in the color or amount. Now, dark urine, bloody urine, or urinating much less than normal are all warning signs. Your urine should be pale yellow, like lemonade. If it's dark, like apple juice, or if you see blood, or if you're barely urinating at all, your kidneys are struggling. Let's move on to the fourth silent sign, the one most people miss: persistent itching. This is the sign most people miss. And it's the one that same professor of mine said was the most overlooked symptom in his entire career. Imagine this. You're sitting at your desk and suddenly your skin starts itching. Not just a little itch, a deep, maddening itch that no amount of scratching can fix. It keeps you up at night. It drives you crazy during the day. You try lotion, you try different soaps. You think maybe it's dry skin or allergies or stress, but it's one of those things. It's your kidneys. Here's the science behind it. When your kidneys fail, the waste products and toxins build up in your blood. Some of these toxins get deposited in your skin. Your body recognizes them as foreign invaders and triggers an itch response. It's like having tiny irritants embedded in your skin that you just can't wash off because they're coming from inside your body. There's also another factor to this. Your kidneys help control the balance of minerals in your body, especially calcium and phosphorus. When this balance gets disrupted, it can cause itching. The medical term is chronic kidney disease associated pruritus, or CKD-AP for short. Studies show that about 40% of people on dialysis experience this, and about 20% of people with earlier stages of kidney disease have it as well. But here is the kicker. Most people never connect the dots. They see a dermatologist, they try creams and medications, but the itching doesn't go away because they're treating the symptom and not the cause. That professor of mine used to say, if a patient comes in with unexplained itching that won't respond to treatment, always check the kidneys. This is the sign most people miss. Don't be one of them. Let's move on to the fifth sign, which is digestive changes. Let's talk about your stomach for a while. Specifically, when food stops sounding good. You sit down for dinner and nothing appeals to you. You take a few bites and feel nauseous, or you have a metallic taste in your mouth that just won't go away. That friend of mine, which I spoke about earlier, said, I think I'm just stressed and I've lost my appetite. But stress wasn't the problem. His kidneys were. When your kidneys fail, those uremic toxins we talked about earlier build up in your bloodstream. Those toxins affect your digestive system. They make you feel nauseous, cause vomiting, and kill your appetite. Think of it like this. Imagine trying to eat a meal while breathing in exhaust fumes. Your body is so overwhelmed by the toxins that food becomes unappealing. There's also that metallic taste. It's called dysgeusia. It happens because waste products in your blood starts affecting your taste buds. This leads to weight loss, not because you're trying to lose weight, but because you literally can't eat. And when you're not eating, you're not getting the nutrients your body needs to function. Studies show that poor appetite and nausea are common symptoms in advanced kidney disease. They are your body's way of saying something is very wrong. If you've lost your appetite for weeks and you can't figure out why, it's time to get your kidneys checked. Let's move on to the fifth silent sign, which is the mental cloudiness. Have you ever walked into a room and completely forgotten why you went there, or struggled to focus on simple tasks, or felt like your brain was wrapped in cotton? We call this brain fog. And while everyone experiences it occasionally, persistent brain fog can be a sign of kidney failure. Here's why. Your brain needs clean blood to function. It's like a high-performance computer that needs a constant clean power supply. When your kidneys fail, your blood becomes contaminated with toxins. These toxins cross into your brain and interfere with normal brain function. They affect your ability to think clearly and remember things, and also to concentrate. It's called uremic encephalopathy in medical terms, but in plain English, it means your brain isn't getting the clean fuel it needs to run properly. When researching for this video the other day, I came across a study which shows that people with chronic kidney disease often report changes in mental status, difficulty concentrating, and even memory problems. If you're experiencing brain fog, especially combined with other symptoms on this list, your kidneys might be the culprit. Let's move on to the seventh silent sign, which is breathing difficulties, and the final sign is shortness of breath. It can happen in two ways. One is because of fluid in the lungs. Remember how we talked about your kidneys controlling the fluid balance? When they fail, fluid can build up, not just in your feet, but also your lungs. Think of your lungs like sponges. They are supposed to be filled with air, but when fluid accumulates, it's like trying to breathe through a wet sponge. You feel short of breath, especially when lying down. And the second way is anemia. We talked about this earlier with fatigue. When your kidneys don't make enough erythropoietin or EPO, which is what produces the red blood cells, you don't make enough red blood cells. Fewer red blood cells means less oxygen delivery to your body. Your lungs try to compensate by making you breathe faster and deeper, but it's not enough. You feel winded, going upstairs, or even just walking across a room. This is serious. Shortness of breath is your body's emergency alarm system. It's saying, we need help now. If you're experiencing unexplained shortness of breath, especially with swelling or fatigue, get medical attention immediately. Now that you know the 7 silent signs, let's talk about who's at risk. The biggest risk factor for kidney disease are diabetes and high blood pressure. These two conditions are like slow motion wrecking balls for your kidneys. Other risk factors include being over the age of 60, having a family history of kidney disease, having heart disease, obesity, smoking, certain medications like naproxen or ibuprofen, having autoimmune diseases, or even recurrent urinary tract infections. Here's a sobering statistic I saw the other day. Among people with diabetes and high blood pressure, only about 20% get proper kidney testing. That means 80% are walking around not knowing if their kidneys are failing. If you have any of these risk factors, you need to get screened. A simple blood test and urine test can tell your kidneys that they are functioning. For symptoms, remember, 9 out of 10 people with kidney disease don't know they have it until it's advanced. Let me bring this home. Your kidneys are silent workers. They don't complain. They don't make any noise. They just keep working until they can't anymore. But they do send signals: fatigue, swelling, changes in urine, itching, loss of appetite, brain fog, and shortness of breath. These aren't just random symptoms. They're your body's way of asking for help. My professor's words echo in my mind. The kidneys are like janitors. Nobody notices them until they stop showing up. Don't wait until your kidneys stop showing up. If you recognize yourself in any of these 7 signs, especially if you have these risk factors like diabetes or high blood pressure, make an appointment with your doctor. Ask for a kidney function test. It's a simple blood test and a urine test that could save your life. Because here's the truth. Kidney disease is manageable when caught early, but when caught late, it leads to dialysis or kidney transplant. You have the power to protect your kidneys, so use it. And thank you for watching. If this video helped, please share it with someone you love because knowledge saves lives. Bye. Take care of your kidneys, they're taking care of you.